All right, everybody. We'll go ahead and look to get started. And welcome to our webinar today with the U.S. Council for Athletes' Health, an official partner of the NJCAA. And our webinar today, Return to Sport from COVID-19 and a Framework for Health and Safety. My name is Brian Luckett. I am the Vice President for External Affairs and Development with the NJCAA National Office. And we're very pleased to be joined today by our partners with USCAH. And presenting to us today on this topic is going to be Dr. James Borchers. He's the president and co-founder of USCAH. Dr. Borchers holds over 2 decades of experience serving as an athletic healthcare and safety expert. And his experience with healthcare modules includes all levels of athletics. The majority of Dr. Borchers' professional experience lies in sports medicine and leadership, serving in a number of important clinical and leadership positions. He's also an author and speaks to athletic organizations and conferences on a national scale. So what we'll do is we'll have the presentation by Dr. Borchers, and then we'll also have a Q&A session at the end of the webinar. So for those of you that are on Zoom and this webinar functionality, there's a chat button at the bottom. You can actually submit a chat at any time, and then we'll look to answer some questions at the end, or you can hold your questions to be able to submit them through the chat functionality. So again, it's that chat button at the bottom. Click that, submit your question, and then we can get to those at the end of the presentation. But without further ado, I will turn it over now to Dr. Borchers.
Brian, thanks so much, and really appreciate you having us here today, all of us here at the U.S. Council for Athletes' Health. Obviously, appreciate all the hard work that's being done. Sorry about that starting video at this point. All of us appreciate all the hard work that's being done at the collegiate level and certainly at the junior college level for trying to return athletes to sport from COVID-19. And what we hope to do today is provide some health and safety framework around some of the issues that are coming out. We know this is a very timely topic and one that continues to fluctuate daily and needs some organization around it. So what we hope to do in all of our endeavors here is to be collaborative and provide you with some thoughts around where return to sport from COVID-19 is. And certainly if there's any if there are any questions, as Brian mentioned, please put those into the chat room, and we'll leave some time at the end to discuss those as well. So let's move on to the next slide here in the presentation. So I think that when we talk about return to sport from COVID-19, one of the things we've tried to look to do with our partners is to think about how to simplify what we're trying to accomplish here. And we can do that maybe by thinking about 3 questions as we think about how we return students and staff. I think one of those is within our communities, how can we slow the spread of the SARS-CoV-2 virus or COVID-19? And certainly we're going to talk a little bit about that, but thinking about how to slow that spread. Then we certainly want to know how we can ensure that we have as safe as possible home environment, around sport, and then certainly around campus. And then most importantly for our discussion is how soon can we safely resume sport participation? And I think safely has some connotations to it around risk tolerance, risk mitigation, resources, and all sorts of things that we can discuss here today. But we recognize that there isn't one clean box that we can put COVID-19 into that works for all sport organizations. It's really an issue that we need to consider each institution, each organization's specific needs, and work collaboratively to come up with a process that's going to provide us with the best opportunity to allow, especially our collegiate athletes in this setting, to be able to get back to activity. Just so you know, I'm a spokesperson today, but we have a whole team that continually is monitoring the changes and what's happening, not only with this health topic, but other health topics with athletics. And what we're hoping to do is provide the most current information, but also try to give you some ideas around best practices for the eventual return to sport. Next slide. So we're going to talk today about health and safety framework really into 6 categories and provide you with some checklists and some thoughts around this. And the first category will be to talk about the development of policies and programming. The second will be to talk about personnel education and training. And one of the things you're going to hear me talk about today in this area is the importance of education and behavioral modification really in managing COVID-19 in sport. We're going to talk just a little bit about facility preparation and management. I'm certain most people that are tuning into this webinar today have been spending a lot of time thinking about facilities prep and management and have expertise in that area, and we'll provide some discussion around that. We'll talk a little bit about return to campus recommendations and things that we are all currently thinking about as people tend to return to campus. We're going to talk about some training and practice modifications, and then we're going to talk a little bit about sustaining cultural change, which is really where the end product of a return to sport and a health and safety framework around COVID-19, but really around any topic gets to when we finish the conversation. Next slide. Thanks. So let's talk a little bit about the development of policies and programming. You know, one of the things that many organizations have been working on during this time is developing policies and programming that allow for a return to campus safely for athletes and a return to sport. But prior to the return to campus and return to sport, we have to actually have these policies and protocols established, and they need to be living documents. Oftentimes we want to get into policies and protocols that will kind of be finalized, black and white. They go into a manual and we can refer to them. Unfortunately, in this situation, these need to be living documents that can be modified and edited frequently. That can be shared transparently and updated based on the best evidence. So the first thing that we recommend is that we identify individuals that I'm certain many of you have done on your campuses that can assist with the development of policies and programming protocols. And what we ask folks to do is think about how they create an athletics COVID-19 action team. And an action team is a group of individuals that can really think about the issues around COVID-19 as it's specific to athletics. And that's folks that can connect and adhere to local, state, federal, and even international guidelines, and be able to think about how that affects what's happening in your community, your campus community, as you think about bringing athletes back. For example, there could be local or state guidelines that recommend that athletes coming from certain areas to your campus need to quarantine and how you're going to deal with that, and certainly international guidelines around quarantining. So just think about thinking about those sorts of issues are going to be really important, and I'm certain many of you have been thinking about those things. It's not just enough to think about our medical staff. We certainly need to collaborate in our COVID action team with risk management and legal staff regarding any obligations from your university or your local municipality or state or federal guidelines around testing, monitoring, contact tracing, which we'll talk about, symptom reporting, quarantine and isolation, but certainly thinking about those issues, which I'm certain many of you are, and how you're going to accomplish that. And also about the ideas about who may be helping you accomplish that. Certainly want to partner with experts to create institution-specific requirements. Each institution is, as we mentioned, is different. One of the things we found is that people are looking for answers that can be uniformly applied. And there are some things that are uniform, you're going to hear us talk about that you've heard probably a lot recently, wearing masks, socially distancing, avoiding large social gatherings, those sorts of things. But there are very institution-specific requirements that need to be thought about. Certainly in this area, thinking about best practices that have been provided by different governing bodies or different issues. And oftentimes what we're asked to do is help to compile that information. And what we try to do is work with institutions to think about how to best apply that information. So that could come from areas like the NATA or the AMSSM, other medical organizations that are thinking about how to govern return to campus, return to athletics, and certainly how you put those together and how you actually operationalize those in your campus is really important. One of the things that we definitely have endorsed and think every institution should do is to identify a chief infection officer, which is the decision maker for return to work or sport in light of COVID-19. And that very often at many institutions is the head athletic trainer or potentially a team physician or someone with medical background that is really thinking about how this infection is affecting the community and making specific decisions about the return to work or sport. We found that in these situations, it's really important to have a decision maker that's clearly identified to avoid any confusion amongst coaches, administrators, athletes, their parents, for example, on what the decisions are and the policies in making those decisions. Next slide. So appropriate policies and procedures for safety. We certainly have to think about those for our healthcare personnel, and many of those will come from healthcare specialists. We have to think about social distancing policies and those policies in public places, but also in our athletic environments, certainly, for example, in athletic training rooms and locker rooms, on practice fields and practice courts, how coaches and support staff will interact with student athletes, and how we're going to enforce social distancing. Certainly, there'll be policies around testing procedures if and when they exist, and certainly symptom monitoring for all essential personnel. And certainly many of you, I'm certain, are thinking about these things, as we know that at the collegiate level, that in athletics, these are important issues that many institutions are thinking about. Certainly a contact tracing plan is really important. I think many of you being familiar with the CDC guidelines that just recently changed, looking at issues around how long isolation needs to last for a positive, but also the 14-day self-quarantine for high-risk contacts and a contact tracing plan, and who's going to perform that contact tracing plan, what sort of training is required, and how that'll be administered, and what is actually considered a high-risk contact is certainly going to be important. And then the criteria for quarantine and isolation protocols on your campuses for your individuals, and that'll be obviously dependent on your environment and your student athlete population, where they live, their transportation, practice environments, those sorts of things. And then certainly want to think about return to work, but more importantly here, return to sport criteria and what the protocol is going to look like, not only from the infection standpoint, but transition periods and how to get people back to sport following this infection and what's going to be required for them to actually return to sport. And fortunately, I'm certain many of you on this call have expertise in that athletic healthcare area, bringing athletes back from injury and illness to sport. And it's equally as important here, where many athletes identified at risk from COVID may get into a period of deconditioning. And so thinking about how we're going to do that is going to be really important. And I'm certain many of these policies and procedures are things that, that you're thinking about currently. Next slide. So for healthcare professionals, certainly we want to adopt practices that limit exposure to viruses, and these are things that are oftentimes very common. We're recommending the use of personal protective equipment, certainly face mask and other personal protective equipment when appropriate, goggles or face shields. We certainly want to limit access to modalities such as hot and cold tubs and pools, which require strict hygiene and cleansing and appropriate disinfection if they're at risk for viral spread. We want to look at a ratio of healthcare providers to athletes in each facility, and usually in the athletic training room. And this has really changed the use of the athletic training room, where athletes in the past have used the athletic training room as a common safe ground and gathering place to meet with their healthcare provider and in the athletic trainer. But certainly now we want to make certain that athletic training room is a protected environment so that the athletes can receive what they need without risk of spread, and determine how we're going to deliver that care. So it may be by appointment only rather than walk-in, and how healthcare providers are going to treat athletes with illness, whether that's going to be remotely through telehealth, and potentially obviously keeping those athletes at home. So just some ideas around some of the things around healthcare professionals. Next slide. So we mentioned social and physical distancing policies and recommendations, and Certainly we want to maintain, as I mentioned, those social distancing as much as possible to educate all our essential personnel on these standards. And as I mentioned, some different environments where we need to think about social distancing, but certainly a lot of personal responsibility for athletes and others to maintain this social and physical distancing, and thinking about the actual layout of your locker rooms, training and competition facilities, medical facilities, and dormitories, for example, are going to be things that need to be considered. And then certainly personal and group hygiene, which I'm certain many of you have already addressed, certainly hand washing, hand sanitization, and then, things like coughing, sneezing, and those sorts of things. But it'll even come down to, after practices and things like that, where do people shower, and where do they change, how do they pick up food, those sorts of issues as well. Next slide. So testing and monitoring protocols that are practical for your institution. I want to emphasize they're practical. You want to consider certainly the following: what types of testing might be done, if any testing is going to be completed at your institution at all. Will it be based on symptom monitoring? Will there be a surveillance type program? What is the frequency of that testing? And certainly consulting with experts on what type of test you're doing. What populations are going to be tested, whether that includes athletes, coaches, staff, other folks. And certainly cost is a major issue with testing, and who's going to be responsible for that if you're going to do that, and who monitors those tests and then makes those decisions. And here's an area where certainly testing and monitoring the policies to ensure they remain current is really important. So this is where this living document comes into play, and consulting with experts that can continue to update you and give you ideas about how to make certain that those policies remain best for your environment. We certainly want to look at a system where you get continuously monitoring for symptoms, and certainly that's something that should be done frequently with individuals in athletic environments, looking at the risk potential for infection, looking at things like respiratory symptoms or other illness symptoms, certainly looking at daily temperature, and then looking at potential exposure to someone who's been sick, or a known exposure to someone who's positive, will help reduce the risk of spread in athletics, and certainly the risk of spread amongst our athletic population. Next slide. We talked about a contact tracing plan, and certainly identifying others that have been exposed to individual that tests positive or are COVID positive is going to be really important, and certainly making certain we understand what a high-risk contact is. And so we certainly think that contact tracing is something in COVID that's going to be extremely important, and certainly something that may require a lot of cooperation from either local healthcare personnel. As we already know, our healthcare personnel oftentimes in athletics are overextended and don't have opportunities or time to do this. Certainly want to look at quarantine and isolation protocols, where if an individual does test positive, do they go? What's the time frame for isolation? And what symptoms and tests qualify for isolation? How do we determine that someone's positive? And what's the difference between a self-quarantine, for example, and isolation? And that's going to be important to define here as well. And then certainly that return to work or sport criteria. And we want consistent criteria for each individual or team to return to activity, including when we need to stop activity. So what number of individuals, for example, on a certain team have to be tested or contact traced to stop that team activity for a certain period of time. And then how are we going to develop acclimatization programs for each individual returning from period or teams from period of time away? And certainly that's going to be really important as we think about that return to sport and some of the other health issues for athletes. Next slide. So this is just a checklist. I'm not going to, but just some things that we hope to provide for you to give you ideas of things that you might think about, just as a brief reference. And these slides will be made available to you at the end of the presentation today. I know that Brian and Sydney and the NJCAA were going to make these available to all the people on the webinar today. But this should hopefully give you some just ideas and a reference to look back at when you think about policies and protocols as you're developing in them and continuing to edit and compile data around them on how you would work through some of these issues with your COVID action team. Next slide. So I want to quickly move on to category 2, which is personnel education and training. And certainly when we've been asked by many national organizations the most important thing about COVID-19 and returning to sport, and it's clearly education and the compliance around education and then behavior modification. You're going to hear me say this in the next category, but we can't test our way out of COVID and make it safe. What we have to do is work on education and then certainly making certain that we have behavior modification. So we recommend that education needs to be provided to all athletes, coaches, and staff prior to or upon return to campus. And certainly we want to make certain that that process is ongoing and meet the ever-evolving and most current requirements or best practices or control and the control of COVID-19. And so that can oftentimes be onerous if you're trying to meet with each of those groups, but taking an education module or looking for policy transparency certainly can be one way to approach that. And certainly some of the issues that we need to provide training and education for our athletes and coaches and personnel are the areas that they're not as familiar with, like the use of personal protective equipment, issues around hygiene, what is appropriate social distancing and why it's important, that daily symptom monitoring, and then appropriate reporting, and certainly making certain that we're following up on that reporting. And we want to make certain that during that time that the training meets whatever institution requirements there are, certainly local and especially state requirements for participating in athletics with COVID-19. Next slide, please. So the fundamental components to consider for education include that we want to make certain the education is relevant to the specific groups we're trying to educate, that we apply it consistently, and the plan for education should be transparent. Really believe that education in this area needs to be something that is really transparent. We recommend that there's an assessment following the education so that we know that at least basic elements of the education are understood by all the learners, and that there's an attestation following that education that they recognize that they've received the education, that they have the ability to ask questions, and who they can go to ask questions about that. And all of this leads to the ability for the institution and for the healthcare providers then to have a good compliance around this education process. Next slide, please. So certainly when we say education must be relevant to specific groups, we're thinking about healthcare professionals, student athletes, coaches, staff, administrators, and it may be that that education is best delivered slightly differently to each of those groups. So certainly want to be thinking about that. We want to make certain it's applied consistently. So sometimes an education committee can help us do that, and they can provide education and training. And oftentimes there's e-learning platforms that can deliver that content. But as our council has learned, certainly cooperation with experts in education and delivering information through different modalities is really important when you're thinking about education in these areas. We want to make certain that our plan for education is transparent. So certainly we want to make certain that that education and programming content is readily available, for example, on the institution website, and distribute that program to all of our athletic department staff and institution leadership. We've even recommended for many institutions that they give their parents an opportunity of athletes also to be involved to make certain that everyone's consistent in the education that's being provided around this area. Next slide, please. So an assessment following education, we found that electronic learning platforms are best to have an assessment for content mastery, and that this electronic learning platform should provide access to the modules via easy use, like a smartphone or tablet, which really makes it easy for the end user to use and keep compliant around that. I mentioned attestation, so certainly confirmation that each individual and group has reviewed the information, that they understand the responsibilities, that they provides additional resources in training when it's requested, and certainly where those questions can be directed to the education committee to provide clarity when needed. And this sort of process is really important to complete the education process in this area. Certainly, there's certain areas where education and programming is going to need training, rehearsals, and frequent reviews. Again, we mentioned over and over again, this should be coordinated with institutional, local, state, and federal guidelines, but that the content is also consistent with your institutional programming, and certainly the things that are happening on the institution away from athletics should be incorporated in this education. So this sort of program, we really believe, will lead to behavioral change, which is really going to be the best way to mitigate the effects of COVID-19 and spread amongst athletes. Next slide. So again, another checklist for you here on this second category around education and training, and certainly gives you some reference here and maybe some solutions or ideas around solutions to meet the goals around education and behavioral change. Next slide. So certainly facility preparation and management for medical facilities and campus facilities. Certainly we want to make certain that there are guidelines and standards for all these facilities that allow us to train the personnel for return to participation. So those need to be established in our policies and protocols. And we certainly want to think about various areas where we identify and implement safety measures at each facility. For example, things around equipment maintenance and what are the resources that are there for equipment maintenance and the personnel for equipment maintenance and the proper procedures to maintain the equipment in a important fashion to mitigate the risk of COVID-19. Certainly we want to think about resources for proper hygiene and what that's going to look like, a disinfectant and sanitation plan, looking at not only proper hygiene with hand sanitizers, for example, face masks and those sorts of things, but thinking about how the facility itself is going to be treated on a daily basis. And even simple things like thinking about where access is to the facilities, who has access and where the entrance is, separating entrances and exits, being able to maintain a living document of who's in and out of each of the facilities to understand if something does occur, how we can appropriately identify and contact trace to the needed number of individuals to know what the risk is for potential spread. So these are some ideas around guidelines and standards for facility preparation. Next slide, please. So thinking about equipment maintenance, as we mentioned here, we want to make certain that all equipment and surfaces as recommended should be sanitized and disinfected after each use. That includes athletic training room equipment and tables, which certainly our healthcare providers and experts do on a routine basis. And even more importantly, probably for our athletes that are using weight rooms or conditioning rooms and spaces. And certainly we should prohibit the use of shared personal equipment such as water bottles, any sort of shared cups, towels, things like that, and think about how we're going to make certain that that equipment is replaced properly. As far as disinfectant and sanitation plans, certainly we talked about protocols there, making certain that those plans are there. And then when we think about the access and entrance to facilities, we want to close all the training facilities to the general public. We want to make certain that we have a quarantine area for use when needed if someone shows up that's symptomatic or has a fever. Certainly an isolated daily check area where people have their symptoms either checked or are using a program and showing that they've checked their symptoms at home. Want to implement and monitor the arrival and departures, as I mentioned, for appropriate contact tracing, and certainly supervision protocols for all the training sites and who's responsible for those training sites and certainly for the athletes there. And I'm certain that these are things that many institutions and the people at those institutions are thinking about, but really important things to think about when we're thinking about mitigating spread and risk from COVID-19. Next slide, please. So here's again just a small checklist, and certainly many folks will in these areas will be thinking about working with facility experts for the preparation and management of their facilities, but certainly facility preparation and management and the education of those folks taking care of those facilities is extremely important as we think about the management of COVID-19 and return to sport. Next slide, please. So return to campus recommendations, and certainly these continue to evolve and continue to take on different forms and flavors as people are getting closer and thinking about bringing students and athletes back to campuses and back to athletic competition. So return to campus and return to sport participation require an instant commitment to the change to change the culture of athletics. And certainly when we think about those things to return to campus and sport, it involves things that we haven't thought about in the past, such as the implementation of testing and monitoring. And certainly testing is an area where there's been a lot of discussion, how often to test, how frequently to test. I think we've seen that in college athletics, we're not going to be able to use the bubble mentality that's being used currently in NBA or NHL, where we isolate the environment only to the athletes and those people that are involved in athletic contests. That procedure and protocol seems to work the best, but we're also seeing that in other areas such as Major League Baseball, where people interact in the environment outside of the athletic competition at home or in the public, we're seeing and associated with travel issues that testing can't solve with exposure. And so it's going to be really important to think about that when we think about testing. We want to think about risk mitigation. And so certainly, how do we mitigate that as much as we can, the risk? Are we thinking about things like practicing in smaller groups, practicing in split groups, how we're going to actually go about mitigating risk in those areas. I mentioned before the compliance to social distancing in various different environments, which is going to be really important. Coaches, for example, needing to coach somewhat differently, thinking about that social distancing, thinking about personal and group hygiene strategies, and then thinking about those isolation and quarantine procedures, especially for those athletes that are either contact traced or become positive, and what the protocol will be for them when we think about return to campus and sport, and if that's even achievable, and whether or not we should proceed. Next slide. So we definitely recommend the implementation of testing and monitoring when appropriate. That starts with a daily health check for athletes, coaches, and staff. And so we recommend that every person entering an athletic facility follow a process that allows them to report those daily symptoms and temperature to make certain we identify anyone that might be symptomatic with COVID-19. If an individual does have symptoms, obviously we've recommended that there's an established process so that there's an isolated area where that individual can be further evaluated, and a process for them to go to either be isolated or get testing when appropriate, and certainly want to uphold our facility maintenance standards when someone does test positive for hygiene and disinfection. I think with risk mitigation, one of the areas that we've been asked about a lot and we discuss is the role of essential personnel. We really want to contain the population that will be involved with the athletic programs to just essential personnel. So we know that oftentimes there are other identified individuals that may have a peripheral involvement with athletics in the past. Really, it's important to identify who should exist inside that athletic bubble, what personnel need to be essential, quote unquote, to the athlete and their development and participation, and what personnel can interact with either the athlete or the staff at a remote distance in order to decrease the size of individuals and the size of the athletic group inside that bubble. And so that's something that many groups have been thinking about, and how to identify that. Next slide, please. We want to really think about, as I mentioned, the compliance to social distancing, and I've mentioned again over and over personal and group hygiene strategies. So certainly thinking about the physical separation of athletes, coaches, and staff, continuing to utilize, for example, virtual meetings when possible, making certain that when we are meeting in person that we have appropriate face mask use in all public places, and when not exercising, making certain that there's separation in those areas, and that when appropriate, we limit the amount of interaction there is between those individuals if it's a high-risk situation. Certainly, as we have talked about the small groups here and that minimum of 6 feet in between individuals. But I think the new standards here in healthcare are really going to require people to think about a new paradigm when they think about how athletics is conducted. And I think this is something that can be difficult to get some buy-in on. But when you recognize the importance and risk mitigation, really important to think about how to do that in your facility. Certainly the isolation and quarantine procedures, we want to have mandatory reporting of health changes, which we've talked about. I think one of the big things is the stay-at-home requirements, and that's not only for athletes that may be symptomatic, but certainly for our staff and coaches and others, this is something that usually in the athletic environment is not normal. Most people want to come in, they want to try to work out, they want to try to be with their team or with their athletes, and certainly we want to make certain that we have recommended stay-at-home requirements and understand that this is really important, and think about the diagnostic steps if someone does need to stay at home and what that protocol looks like if someone may have symptoms of COVID-19 and how they might go about testing and or isolating until those symptoms resolve. Next slide, please. So again, just a reference checklist here for you again on this return to campus recommendations, just some things again to think about as you think about your planning process, and certainly many of you I know are thinking about these things and continuing to monitor and think about how to put into place planning for this. Next slide, please. So training and practice modifications. I think one of the things that's come out of COVID-19 is that we recognize we can't do things the same way. And we need to know that, that there's going to be changes to the way that we train and practice sport and athletics in order to make it possible. And it really needs to be applied to the following areas. Certainly we need to look at our facilities and the risk evaluation. We need to look at sport-specific risk evaluation, and then really thinking about that individual acclimatization and the return to sport. Next slide, please. So when we think about facility-specific recommendations with the athletics COVID-19 action team, every practice and training facility really needs to be evaluated, and they need to be evaluated for the risk of the level of risk at each training and practice facility. For example, things like whether or not the training takes place in a small space indoors or if it's an outdoor facility, what those facilities look like, how many individuals are in those facilities, what's the population density, and certainly we know the more we can do outdoors spaced, the better off we are than indoor in a dense area. But that may not be possible for certain athletics, and so we really need to think about that level of risk and what that encompasses. And then certainly, obviously, the issues around we've seen with travel and competitions with team in different geographic areas, and certainly whether or not travel is appropriate, how we're going to compete, where that travel occurs, should there be overnight travel, should we try to limit travel and play more regional competition, and are there geographic areas that maybe our institution does not want to travel to. Certainly things thinking about the facilities and just the travel and competition with teams in those areas, and looking at the facilities they have to compete. We certainly want to reduce the levels of risk as much as possible, and some strategies to do that are to limit physical contact with others as much as able. And certainly in sports like soccer and football in the fall, there are certain times when physical contact is unavoidable, but we may need to think about how often that occurs, and if there's other ways to limit contact with, for example, with set pieces in soccer, on a corner kick, how many folks are involved in that, or how often we practice that, or in football, using limited small groups for practice, and really trying to maximize the amount of time that individuals can get training without having to have full team contact. Certainly want to limit competitions with teams from different geographical areas when possible. And many conferences have looked to do this, and other institutions have, but certainly many medical individuals will be asked to look at this as well. And certainly perform skill building drills and conditioning while practicing physical distancing, and looking at the actual drills you're doing, and making certain that we can limit how much space might be in between individuals, and trying to take advantage of individual development as much as possible. Next slide, please. Certainly there's sport-specific recommendations, and I'm certain many of you have seen that for some sports, especially contact sports, the level of risk can't not be reduced without changing long-established training and practice procedures. But we need to try to reduce that risk as much as possible when we're able to. And certainly that has been a challenge for some sports, and there are some sports where this is just inherent to the sport itself. But certainly looking at sport-specific recommendations and making certain that we're continuing to examine what those issues are within sport itself. And then individualized training and practice recommendations really need to think about individualized acclimatization programs for each athlete. We know that there's unknown activity levels when athletes have been quarantined or away from sport, especially in the last 3 to 6 months. Certainly need to be thinking about this specifically when we return to activity from illness. And we've seen prolonged return needed from COVID-19 athletes that have been ill. And so rethinking how we approach individual acclimatization for those athletes. And then certainly thinking about all the things that we normally think about in collegiate athletics when you have athletes that are returning from different geographical areas, thinking about heat, temperature differences, workloads, those sorts of things are going to become even more important in this time period, as many individuals are not going to be coming from the same background and are going to need more specific issues around acclimatization. Next slide, please. So again, some things to think about with training and practice modifications, and certain most of you are thinking about some of these issues, if not all of them, and just giving you some ideas around areas that we've found have been important to organizations as they think about return to sport. Next slide, please. The last category is by far the most difficult, and certainly I know the one where most people find the most challenge, which is sustaining cultural change, which is really what's going to lead to our ability to return to sport. In creating a return to athletics and return to campus roadmap is really a commitment to cultural change. And so when we think about cultural change, we have to think about all the things we've talked about at all these different levels. And creating that change really requires the first 5 categories that we've talked about. But sustaining it really requires an unconditional buy-in from athletes, coaches, medical staff, department staff for athletics, that there's a commitment to that change, which will allow us to participate. And unfortunately, that unconditional buy-in means that we have to sometimes challenge ourselves to do things that maybe even our colleagues and other folks in the community are not willing to do, which may require us to really avoid areas where there's group gatherings, may require us to really think about what the ability is to make certain that we can have safe athletics, because that is the ultimate goal, is to make certain that we as much as possible can make this environment safe, have uninterrupted participation in competition. And when we're thinking about challenging some of the protocols and issues that have been there in the past around athletics, when we change that paradigm, can raise anxiety and certainly be a challenge. But sustaining that cultural change is going to be paramount, as I'm certain most people here would understand in order to be successful. Next slide, please. So some of the consideration for cultural change is that we know it takes time and effort, and that can be difficult to put that into effect. But certainly measuring that is important. We know that cultural changes are more difficult with changing policies. For example, COVID-19, and in medicine, we have new infections like this. Things continue to change, and we need to be able to respond to that, and that can affect cultural change. The other thing we need to recognize, and I think this has been out there now, is that even with a vaccine or a treatment, a good oral treatment, cultural change will take persistent and continued education. Just as we can't test our way out of COVID for safe sport, a vaccine does not ensure that we're going to be able to have safe athletics with no risk of infection, and certainly the same with a treatment. And although these things are very important to allow us to return to what we knew as normal, really are not going to take the place of what we need to do to think about continued education and behavioral change. And certainly we know that we need support from leadership, our medical leadership, certainly administrative leadership is especially critical in affecting this cultural change. And so that support is going to be important for all organizations, but institutions as well, to have that cultural change to sustain success. Next slide, please. So again, just some things to think about here when we think about cultural change, how to create it, how to sustain it, and certainly knowing that oftentimes we need some assistance to be able to do that. But organizations that have been able to move towards this and move towards some of these challenges, I think are really where they're going to find the most success in creating a great environment for all of their athletes and those involved with their athletes to have a successful participation. Next slide, please. So that's really the end of the formal presentation. Certainly, Brian, I know there's probably some questions here and maybe in the chat or other people, folks that have questions. Again, our council is available and has been cooperating with the NJCAA in providing guidance and resources to help institutions return to safe sport, and we'll be providing this resource and other resources through the NJCAA, hopefully to engage folks that would be interested. We'll be providing to Brian and Sydney and others at the NJCAA information that they can distribute to you, not only regarding this presentation. We have another presentation this upcoming week with medical experts to really look at some of the specifics around what is going on with the infection and what to expect. Webinar through USCAH. We'll provide that information for the NJCAA and get that distributed to everyone as well. We think that'll be helpful for individuals as well. Certainly more opportunities there. But Brian, I guess if there are questions, certainly try to answer those questions and provide some more feedback. And if we don't get to all the questions, please, if there are individuals out there, please do not hesitate to contact us. Our goal is to help provide solutions and collaborate with individuals to make certain that we can provide resources and solutions in order for a safe return to sport with COVID. So we know there's a lot of mandates out there, but it's how you address these and think about safe return to sport that's going to be really important. So Brian, I guess if you want to fire away with some questions, certainly available for that for the next few minutes.
Absolutely. No, I appreciate that presentation, and we do have some good questions that have come in. Again, if anybody has any questions, you can put them through the chat feature. We'll get to as many questions as we can, so let's go ahead and get to it. Dr. Borchers, are you recommending testing for all athletes and staff prior to return to a college campus?
Sorry about that. I think I was muted there for a second. So, that's a great question. And I think that the first question is why, I think we have to ask ourselves is why are we recommending testing? And I think the reason to recommend testing prior to starting is so that we can understand what the prevalence is of our athletes coming in, who may have been exposed, and what are we starting with, and what are those risks to getting started, so that we understand, kind of where we are moving forward. But there's economic questions to that as well, and there's certainly, each institution is a little bit different. In general, if we could test our athletes and our coaches and our staffs in that essential personnel area prior to starting our training, I think it is an excellent idea, because there is really good evidence that if we understand what the prevalence of this infection is starting out, we can institute some things even from the start to try to prevent further spread in the athletic environment. The testing question is a good one. Sustaining testing is a different question and becomes a different question altogether, and the value of sustaining testing. But an initial test, I think, is a good idea. Sustaining that, or thinking you can test your way out of this virus, is not possible. And so we have to understand why we're using testing.
Awesome. Thank you for that. What are your thoughts on the new suggestion of wearing goggles that's recently come up?
Yeah, so here's my thought on that. I think that we know from healthcare workers that the actual spread in an environment of normal activity, if you're talking about, this virus does not, is a virus that comes from the lower respiratory tract. So from things like sweat and those sorts of things is not really an issue for, for the spread of this virus. Now, that being said, is there a hypothetical risk that if we were wearing a face mask, that if the eyes were exposed and someone were to sneeze, for example, or cough repeatedly, into someone's face and the secretions were to get into the eyes, that they could potentially get infected? The answer is theoretically yes. Do we clinically think that that is a significant risk? And the answer to that is no. So do I think in a healthcare situation wearing goggles or a face shield is appropriate? Yes. And I think the athletic training staff and medical staff should have those available. Do I think that if you can put a shield on a face mask, for example, and it doesn't inhibit play, is that reasonable? Yes. Do I think all individuals in public need to be wearing goggles? The answer is no.
All right. Thank you for that. And just a reminder, we've got a couple of questions. This presentation and the recording of this webinar will be made available to everybody that is registered, and we're also going to place it to be available on NJCA Connect for people to be able to see it there. So this will be available for those that have asked that question. Next thing, do you have any specific recommendations for bus travel?
So the question about travel has come up to us frequently, and certainly it's a question that comes down to resources. So certainly socially distancing. So the idea that you either use every other seat and only one person per seat so that you can maintain that, appropriate social distancing is something that is recommended. That gets really difficult when you're talking about traveling, for example, a football team where you might have 60 to 100 members, right? And so recognizing that, that's where certainly testing can be used and has been recommended by some groups, but that becomes difficult as well. As much as possible, you want to create as much distance as reasonably possible. So there, we have actually looked at, for folks with smaller groups, for example, seating in every other row and using some checkered seating where you sit one person against the window and then the person in the next row is against the window on the other side. Then you skip back to the window on the other side, and that would be a way that you can certainly space in both directions for social distancing. But certainly travel has been an issue, and certainly the number of resources. But when looking at busing, trying to reduce the population density is really important.
Is there a guideline or recommendation that you would have for safe return to sport with phasing from team meetings to practices and then into season gameplay? So as they're going through workouts and the team meetings and practices and then getting ready for a season of competition, do you have any guidelines for a safe return through that process?
Yeah, so we've certainly worked with institutions on that, and not to be too general, but I think what we have worked with is, those folks that, if you're starting, it depends on where you're starting from, but certainly coming from thinking about low or limited activity and we put forward, and some groups have adopted a 6-week return to activity protocol that can get you to gameplay, and that's been our recommendation as a minimum. But certainly we have those recommendations, and if there's specific questions around this, if someone wanted to contact us, we'd be certainly happy to share some of those ideas and thoughts and guidelines around those things specifically.
Let's see. Should a college with dorm students and commuting students have 2 different practices? So splitting the two groups up because controlling the contact of the commuters would be impossible since they're leaving campus. Any thoughts on that?
Yeah, that's one of the things that folks have talked about, I know, at this level, about trying to do some, when you think about how to split up groups in order to practice, and groups that are coming from an outside environment versus those that are in an inside environment. I think the question comes down to how much do you trust that the people that are commuting are basically commuting by a private vehicle to their residence and are, quote unquote, kind of self-quarantining for the best that they can at their residence to limit their exposure. And that's kind of that cultural change and sacrifice we've talked to a lot of groups about with sport. If they have to go to work, if they have to expose themselves to other individuals, then it may be a really good idea to think about how to limit the participation of those 2 groups together, just as you would different position groups or your first team versus your second, third, maybe fourth team if you get that deep. so that you don't have the potential exposure for your whole team. That's certainly an issue that we've discussed with some groups, and I think it comes down to what the reality is about that sort of transportation, and how much exposure you think exists with some of those teams.
Do you have any research-based criteria for testing prior to student athletes returning?
Well, as far as research-based criteria to testing prior to students returning, the only research base is epidemiology research, just on the benefits of understanding prevalence of disease prior to a group, that's coming from all different areas, to understand what you might be bringing to your environment. As far as for participation in athletics, there really isn't any research-based, evidence that you need to do that to return to athletics, but it really does help us at least understand what the prevalence of COVID is coming in, and hopefully, we hope obviously that's 0% and that we can keep it that way. But when we have individuals coming from lots of different areas, it does help us to understand that prevalence.
All right, thank you. Could you talk a little bit too about, I know that the services that you guys offer, and this goes to one of the questions of, does USCAH provide, or can you recommend educational COVID training videos for student athletes and or coaches? And I know that's part of what you guys have been working on too.
Yeah.
Could you elaborate and talk about that a little bit more?
Yeah, we offer a very unique platform called Athletics Health Space. And again, this is not please don't take this as a sales pitch, but Athletics Health Space is an assessment, educational, and survey management platform. We do have specific educational programming for student athletes, for coaches, officials, facilities folks, administrators around COVID, the return to sport with COVID. We offer what's called a Game Ready program, which allows for the consistent monitoring of symptoms and temperature around an educational platform. It allows very simply for an organization to be able to monitor compliance around this area, and can be done in a very cost-effective manner. We I know have worked with some NJCAA institutions with this. There's other education there that can be very helpful as well, and other programming that's been very helpful as well. We have certainly worked with a number of institutions to do this, and we do offer that. And certainly anyone that's interested, we'd be happy to, just please contact us. Be happy to reach out. I think that they'll find that it's a very unique platform that can be used in many different fashions to deliver exactly what this person's asking about, individuals are asking about in a very low cost manner. So.
All right, just due to the sake of time, last question here. And there are other questions that have been asked that unfortunately we haven't been able to get to, but again, encourage everyone to reach out to our partners at USCAH with questions you have. They are more than happy to help and to be able to work with you and answer any questions you have. But just for the sake of time, last question for you here, Dr. Borchers. So if teams are going through scrimmages or some type of competitions this fall, or even going into the spring, and the schedule we currently have here in the NJCAA with competition seasons, if somebody is hosting another team and a player shows up and they do have some type of symptoms that they are showing, in your expertise and just your advice, what should be for the host team, how they go about that? What do they do with the individuals that have come there and those that may have been exposed? What happens, just in your advice, for that host institution?
So the first and foremost is to make certain that you understand what the symptoms are. If they are consistent with or concerning for possible COVID-19, that individual, there needs to be a plan to be able to isolate that person from the individual team. So whether or not there is a place on campus or a place where that individual would go to be isolated is important. Next is making certain that they have the ability to get medical attention if it's needed, and make a determination if it's available for appropriate testing before any travel or anything like that. And this is where then contact tracing becomes really important. So if they had a roommate, for example, or if they were within close proximity without a face mask to an individual, determining what other high-risk contacts might not be able to participate that day. So for example, if they had been on the bus and they had been feeling well and then started not to feel well, where were they sitting on the bus? Where was everyone face masked? Did they have appropriate distance between them? And if that's the case, there may not be a reason then to isolate or self-quarantine other individuals. Or if that's not the case, there may be other certain individuals within close proximity that need to be isolated. And then certainly thinking about whether or not the competition can proceed based on the number of individuals that may be affected by that individual is really important. I think one of the things we've been really preaching here is that we need to be vigilant, but we don't need to be hysterical about what we're doing. So that's where understanding what the guidelines are for a close contact, understanding that we can isolate symptomatic individuals, that it's safe to isolate them. We do this all the time in healthcare facilities. We do not need to then send everyone home or limit their spread. We need to make certain that that we understand how to contact trace those high-risk individuals, but it is possible. And I think then the last point of that is to have a transportation plan where that individual, if testing's not available and they need to return to their campus, where they can return by private vehicle or have a way to get back without exposing anyone else. So, and certainly if they have more questions or issues around that area, we've helped a lot of institutions thinking about those sorts of issues. Just please reach out with us to us with those questions, and be happy to try to answer them.
Awesome. Well, thank you so much again for the presentation, the time today. And again, there are a lot of other questions that unfortunately we haven't had the time to be able to get to just due to the sake of time. But please ask your questions to Dr. Borchers and his team. They will be able to get back to you in some way to answer your questions. We know how important this topic is to our membership right now, and we had a great number of attendants today. So again, thank you everybody for joining. Dr. Borchers, you and USCAH, we thank you guys for being a partner and for joining us today, and for your willingness to work with our membership. Again, the slides, presentation, recording, everything will be sent to everybody that registered. We'll also make sure that the email and contact information for the USCAH will be placed there as well for you guys. So again, thank you all for the time today, and again, appreciate everybody joining.